Hello, and welcome to the narrated PowerPoint of the Psychology and Film assignment over the movie Catch Me If You Can, directed by Steven Spielberg, as presented by Danielle Sessions, Mariah Myers, and myself, Luke LaCroix. The character of Frank Abagnale Jr., as played by Leonardo DiCaprio, was a miner who, through his time being raised by a less than successful conman, perfected the art of bank fraud and conned millions of dollars all before his 19th birthday. In several of these instances, Frank Jr. assumed the identities and roles of a pilot, a doctor, and for even a brief time, a lawyer, as well as several other identities to cover his tracks with the intent to more perfectly pull off his cons. It seems clear through viewing of the film that Frank Abagnale Jr. can be diagnosed with what is called borderline personality disorder. The diagnosis for this personality disorder comes to light when we see his unclear and unstable self-image, as well as through the fact that it seems the only reason that he is going on a run is because the chase itself gives him a purpose and reason to keep going. We also see signs of this disorder through the incredibly impulsive behavior that he exhibits and that leads him to change his entire identity at the drop of a hat. One final symptom that points back to this borderline personality disorder is the fear of abandonment he seems to possess that develops from having to choose between his parents during their divorce. However, one symptom that is typical of borderline personality disorder that Frank does not seem to display is a desire for self-inflicted harm along with suicidal thoughts or behaviors. There are many possible treatments for Frank, but the most appropriate would seem to be psychotherapy in an attempt to isolate and relieve some of his extreme symptoms. Another possible method of treatment could be cognitive behavioral therapy, which oftentimes helps people with borderline personality disorder identify and change core beliefs or behaviors that relate to how they perceive themselves. The long-term outcome for his treatment would most likely be about 22-hour sessions of either or some combination of these two treatment methods. These treatment plans would do well for Frank's diagnosis of BPD because they can help reduce symptoms and problem behaviors, relieve symptoms of depression, as well as improve quality of life. In addition, family members are able to go through sessions for support, and judging by the fact that his parents are a large part of why he has this disorder, this should be very effective. There are some ethical concerns, including patient consent and respecting the client and their values, resources, and ability to self-determine while using these treatments. This disorder seems to be portrayed fairly well in this film because of the fact that it is based on a true story along with true events. Additionally, the film is very good at depicting the known symptoms of BPD, excluding the self-harm, which may have been just to protect the viewing public. Viewers and their opinions of psychological disorders can be influenced by film because the reality is that for some, film is the only exposure or source of information when it comes to those with psychological disorders. This fact can cause people to exaggerate the severity of disorders or assume worst-case scenarios because of the dramatization that occurs in film. Thank you for watching, and I hope you enjoyed it.